Hi, I'm Dr. Britt DeNuzio with Grady Veterinary Hospital, and today we're going to talk about canine influenza. So a lot of people have heard about canine flu or canine influenza in the news a lot lately because there is a big outbreak going on right now in our area, in Cincinnati and Columbus and just the general Midwest. So we're going to talk about what it is, when it first came around, and what you need to worry about as a pet owner. So the current strain that's going around is called H3N2. It's just a name we give to the influenza strain to say what type of influenza it is. That strain was first discovered in Chicago in 2015, and since then it's kind of filtered out through the Midwest. We saw an outbreak in Columbus earlier this year, and now we're starting to see cases down here in the Cincinnati area as well. So what happens with canine influenza? It is a virus, and it's very easily transmitted between dogs. So especially we see this being transmitted between dogs that are in high density populations. So things like kennels, doggy daycare, grooming facilities, breeding facilities, those types of places. Although any dog that possibly comes in contact with other dogs is susceptible. It very easily spreads between dogs once they're in the same area. And you can actually carry influenza on your clothing for a short period of time as well. So if you were around a lot of dogs during the day or happen to walk past a dog that was contagious, you could potentially bring that home to your dog as well. So once your dog contracts the canine influenza virus, it can take 2 to 4 days for them to start showing signs that they are sick. And during that time, they can actually spread the virus to other dogs, and it's actually the time when they're the most contagious, so it can be really hard to prevent this virus from spreading around the population, which is why we're going to talk about prevention in a few minutes. So once your dog gets through that 2 to 4 day, what we call incubation period, the most common signs that we see are things like sneezing, coughing, they may have a fever, feeling a little lethargic, not wanting to eat as much, kind of normal things that we expect when ourselves or our pets have an upper respiratory infection. And for most dogs that contract the flu virus, this is all that we really see, is that they may feel a little under the weather, they're showing upper respiratory signs, and within a couple of weeks they're back on their feet and back to normal. However, in some dogs it can progress to a more serious illness, and it can even cause pneumonia. So if you notice any of these clinical signs, we recommend calling us here at Grady Veterinary Hospital to see if your dog needs any medical attention. The things that you would worry about if they're getting more sick than an average dog with the flu is if they're not eating at all, not really wanting to do anything, breathing heavily or having trouble breathing, anything of that nature. Definitely call us right away. We talked about prevention a couple minutes ago, so the best way to prevent this from spreading and from your dog contracting this is actually the influenza vaccine. So we actually have a flu vaccine now here at Grady Veterinary Hospital against this H3N2 strain of canine flu. And how it's given, we give one shot today, and then we would booster that in 2 to 3 weeks from now. That makes sure that they get the full protection from the vaccine. And then we would just do that on an annual basis. So we're recommending this for everybody, really, because of how quickly this virus is spreading through our area. But especially if your dog is boarded, goes to a groomer, goes to doggy daycare, goes to the dog park, anything like that where they're around other dogs, then they definitely need this vaccine. So if you're interested or you have any questions, or if you'd like to schedule your dog's flu vaccine, give us a call here at Grady Veterinary Hospital.